Hello, everyone, and welcome. I'm Moira Junge, health psychologist, recent inaugural CEO of the Sleep Health Foundation, and now passionate sleep health advocate. Thank you for joining us live, some of you, or maybe you're watching this later. This is the final of 3 community-facing free webinars that we're hosting this week for Sleep Health Week to help increase the awareness of the importance of sleep and how to improve it in order to transform our lives. Before I commence, I would like to acknowledge that the Sleep Health Foundation operates nationally on the traditional lands of Aboriginal and Torres Strait Islander peoples. And I'm joining today from Wurundjeri country, which sits on the lands of the people of the Kulin Nation. And we at the Sleep Health Foundation pay our respects to elders past, present and emerging. I would also like to acknowledge the traditional owners on the lands on which you join us today. Can I also acknowledge the combined lived experience and associated poor quality of life at times in the audience and panel members of inadequate sleep, sleep disorders, and mental ill health and other chronic health conditions that are negatively impacted by poor sleep. So Sleep Health Week is the largest campaign of the Sleep Health Foundation every year. We're into our 5th one. The Sleep Health Foundation exists to let the community know that sleep is essential for health, safety, and quality of life. And the key messages on Sleep Health Week for this year are that sleep is a foundational pillar of health alongside diet and exercise, that it's linked to long-term health outcomes, including heart health, diabetes, and mental health conditions. Small changes in your sleep habits can lead to meaningful improvements in your daily life. Better sleep can improve how people think, feel, work, learn, care, and connect with others. And sleeping difficulties can look different across life stages and sex differences, influenced by both biological and social factors. So our sleep health foundation information is rooted in evidence, reviewed by experts, and guided by lived experience. So some housekeeping first. We're recording this today, so we'll keep this recording to store later on our channels as an education and advocacy resource. We do not have a live chat function, but you'll see that there's a Q&A function on your screen. And we've got a wonderful panel, which we'll introduce in a minute. And we've got 5 myths that we're going to talk about that have been selected from our lived experience group. And also some of you who have actually, when you registered for the webinar. So we've got 2 sleep clinicians that we'll get to in a minute, and Aaron will introduce them. But first of all, can I introduce my co-host, Dr. Aaron Schokman. Aaron, who might be well known to a lot of you. Aaron is a lived experience research fellow at the University of Sydney and a member of the Lived Experience Advisory Panel here at the Sleep Health Foundation, which we call LEAP. Aaron was diagnosed with narcolepsy type 1, a rare and debilitating sleep disorder in his late teens that sparked his interest in research, co-design, and all things sleep. So Aaron's going to help me co-host this webinar. And over to you, Aaron, to introduce our panel and tell us a bit more about yourself.
Thanks, Moira. So my kind of lived experience, apart from the research side of things, I've got a diagnosis of narcolepsy type 1. And initially getting the diagnosis was quite difficult. And it was quite a long process to get. For people living with narcolepsy, the average delay between first getting symptoms and diagnosis is between 8 to 15 years. So it's a really long time. But getting the diagnosis is only half the battle. Sleep is really devalued in our society. And when it goes wrong, most people, including friends, family, and colleagues, don't appreciate the enormous impact it has on your life. So what happens is that you end up advocating for yourself a lot of the time, and learning a whole new landscape, different systems, medications, accommodations at work. It's really intense. So what is really important is this information, I guess the information that you have, access to accurate evidence-based information that you can use. When I was diagnosed almost 15 years ago, there wasn't any information really available. It's a little bit better now, but there's still a really big evidence-based gap. And it is hard to find accessible and importantly shareable information. Why this matters is that there's a lot of misconceptions around sleep disorders. Misconception one, I guess, the first one that I always hear is that these aren't legitimate medical conditions. Sleep disorders aren't legitimate medical conditions. Um, every sleep disorder has a biological underpinning, whether it's brain, mind, or body not working or doing what it's supposed to do. Um, and really, they deserve funding, advocacy, awareness, and more government attention. The second misconception is that sleepiness is just laziness. Sleepiness is just a choice when it isn't. My own example, sleepiness around narcolepsy, is that people, I mean, a normal person uh, staying awake for 72 hours straight would experience the same level of sleepiness as someone living with narcolepsy. So it's really impactful long term. And the third misconception is that you can just sleep more to get rid of these sleep disorders. These are legitimate medical problems and really need clinical intervention and a medical team to help address. Um, Continuing on kind of on the theme of misconceptions, it's my pleasure to introduce our two experts today who are here to bust some other common sleep myths that we have. Um, Starting off, we have Dr. Linda Schachter. Linda is a sleep and respiratory physician with over 25 years' experience in the diagnosis and management of all sleep disorders, including sleep apnea, disorders of excessive sleepiness, movement disorders in sleep, and insomnia. We
Thank you.
also have Henrique Salles. Henrique is a clinical, educational, and developmental psychologist who works across the lifespan from children to older adults and has experience delivering psychological and behavioral insomnia treatments. Enrique is currently the team leader at Reconnection, a government-funded service helping people dependent on benzodiazepines, commonly known as sleeping pills, and works as a psychologist at Level Up Psychology. Enrique and Linda, welcome. Um, Enrique, I guess, did you want to start off with just, I guess, any of your initial thoughts around some of the common sleep myths that we hear?
Yes, thank you, Aaron. So, and thanks everyone for coming. I'm excited about today. I think as a starting statement, I work with a lot of people that have sleeping issues, and a lot of them report that they've tried sleep hygiene, they've tried tips that they've seen online, and often it hasn't helped, and they can get quite, have a feeling of helplessness or hopelessness about whether their sleep is going to improve ever. And a lot of these tips aren't either fully evidence-based, or maybe they're helpful, but they're not in themselves actually going to help someone that has chronic insomnia. And so I think maybe today we can help, bust some of these myths or provide some guidance around what is effective, which maybe helps guide them, as well as maybe provide more optimism that things can get better, and how to do that.
Yeah, nice. And Linda, did you have any kind of initial thoughts as well?
Yeah, again, thank you for inviting me and welcome everybody. It's really important to get the right information about sleep. We all have preconceived ideas, and a lot of those ideas are from childhood, what we were told, or nowadays a lot of people are getting their sleep information through social media or from the internet. And it's really important to make sure you get the right information, because if you do go down the wrong track, it can become a vicious circle and make your sleep actually worse. So really important to get the right information so you can improve your sleep. And if it doesn't work, to obviously seek a health professional or a sleep specialist.
Yeah, definitely. I mean, I always see on my social media feeds mouth taping and a whole bunch of stuff that's kind of yeah, whether it's evidence-based or not, it'd be good to get more information around all of this. I guess starting off with our first myth that was submitted, Linda, I guess do you want to start us off with this first one? This we always hear that everyone needs 8 hours of sleep. Um, is that true? What are your thoughts about that?
So our sleep needs vary over a lifespan. So we know that babies and young kids need more sleep, and as we grow up and grow older, we do need less sleep. But Most of us need somewhere between 7 and 9 hours of sleep per night. Now, the main thing to realize is the amount of sleep you need is the amount of sleep that you need. You can't change that. So if you're a 7.5 hour a night person, that's the amount of sleep that you need to wake feeling good and to feel good during the day. But if you're a 9 hours a night person, you can't actually change that. So most people, sort of 95, 96% of the population, need somewhere between 7 and 9 hours of sleep. So that's what we should be aiming for. But really being conscious of what your body actually requires.
Yeah, interesting. I guess on that, I guess everyone's different as well. I was speaking to my nana earlier, and she, often sleeps, 10 hours a night. Does it differ between people
Definitely different between people.
who,
Like I said,
older adults, younger people?
okay, so adults themselves, so as we grow older, our sleep actually changes. We don't actually need less sleep as we get older, but our sleep does change. So as we get older, we've got an increased risk of sleep disorders. So you may need more sleep because you've got a problem with your sleep. But also as we get older, our sleep actually does change. So there may be naps during the day. The sleep quality may deteriorate a little bit as you get a bit older. So, but overall, sleep as an adult stays reasonably consistent with the amount that you need.
Yeah, interesting. Moira, did you have any kind of
And I was just going to jump in there around talking about, sleep need and the duration of sleep. What about sort of I think it's really important to touch on being a morning type or a night owl and our chronotypes. So you have some comments on that, Linda?
Sorry, what was that, Moira?
Whether we're a night owl or a morning type, like our chronotype.
So the chronotype, so most of us all have heard of night owls or morning larks. And, if you're an early morning person, that seems to be your chronotype. Or if you're a night owl, and it's really, most people, if whichever one you are, you're sort of stuck in that one actually. So it's quite hard to change what your body actually wants to do. So if you are an early morning, early to bed, early morning person, or if you're a late to bed, late person, we do our body's circadian rhythm is reasonably set. So you can change it over time with a lot of effort, but most of us, we do have a particular rhythm, and it is better to try and stick to it rather than trying to change it if that's possible at all, obviously. And then we know that shift workers, so changing what you do, so changing from being, your body times and what time or your sleep times is actually really hard to do. So it is important, if at all possible. I mean, the ideal is to go to bed at the same time and get up at the same time each day.
I was going to say as well with the early bird night out, sometimes if you have a partner and they are the opposite, that can make it quite hard. So you have a lot of people that maybe are feeling sleepy earlier in the night but are staying up to go to bed together with their partner, or vice versa, where someone's going to bed quite early, earlier than they really maybe are meant to biologically, and they're just awake for many hours and getting frustrated and tossing and turning.
Yeah.
I mean, your circadian rhythm will swap over time. So if you do have a partner, but it is important not to try and change it too quickly. So it will, if you do have a partner that has a completely different chronotype or different sleep times to you, it's important that you will be able to change it, but don't expect you can do it very quickly. So it will change over time, and maybe you both need to come a bit closer together to try and have a acceptable sleep and wake time.
I suppose when we're talking about duration here and like the myth, everyone
Yeah.
needs 8 hours. I think it's probably important just to get a quick comment from Enrique and Linda too around the other domains. Like people focus on that duration, like the amount of sleep. But what about the other types of things around quality and the consistency and the time, that sort of stuff? What do you think that how can people think away from just the hours and thinking about other domains of sleep?
Well, it's really important not just to focus on the hours of sleep. we do need good quality sleep, and rather than just the hours of sleep. Because I see a lot of patients that I need 8 hours of sleep, but they're waking feeling good after 7 hours, and they feel good and they feel good during the day. Well, that's actually okay. So the main things of all of this is that you sleep well, you wake refreshed, and you feel good during the day. Now, obviously, the range of amounts of sleep that everybody needs may be different. Like I said, I'm a 7.5 hour a night person. People will often quote some famous people that got significantly less sleep, and we
Thank you,
it's
Thatcher,
quite
lady.
common, like Margaret Thatcher or
Yeah.
Bill Clinton or Trump,
Right.
all these people that say they only need 4 or 5 hours of sleep per night. It's really unlikely that they're functioning at their optimal level on really low amounts of sleep. That a lot of these people were driven around, probably nap during the day, and have very high stress, high pressure jobs, which probably affect their sleep as well. So I think realistically, not trying to change the amount of sleep that you need, and not trying to get what your friend needs, actually working out what you need to wake feeling good and feeling good during the day, and then sticking to that amount of sleep.
Can I ask, Linda, if I think that I'm sleeping enough at night and I'm waking up exhausted, really sleepy, feeling sleepy throughout the day, what should I do?
So realistically, if you wake after the what you deem is the right amount of sleep for you, and you wake not feeling like you've slept, so it's really important that there are sleep disorders that no matter how much you sleep, like narcolepsy, no matter how much you sleep, you are never going to wake refreshed. There is a problem with the sleep quality itself. So narcolepsy, while very sleepy during the day, their sleep quality is really poor as well. So those and sleep apnea, restless legs, insomnia, all these conditions, people wake feeling tired. So if you are one of those people, it's really important that you do chat to your doctor about them, because it may be appropriate to have a sleep test, to have a look at your breathing movements during sleep, or it may be appropriate for you to see a sleep doctor like myself to further investigate it and work out what the problem is and how to treat it. So there are lots of professionals that are available to steer you in the right direction so that you sleep well and wake refreshed.
Absolutely. I think we'll move on to the next. We've got 5 myths to get through, and we've on to our second one now about sleep hygiene. I'm going to ask Enrique to talk about that. So the myth, sleep hygiene is what we need. It's going to work. It's a set of rules that works the same for everyone. You just need to try harder with these set of rules, and your sleep will get better. Enrico, over to you. Tell us a bit more about that.
Yeah, so sleep hygiene, it's kind of like a healthy sleep habits. Some people get the term a little bit, find it a bit confusing, like sleep hygiene. So it can be like having a warm shower, but it doesn't have to be around hygiene and cleanliness. It's really looking at, okay, what are helpful habits that we can do throughout the day, at night, when to reduce caffeine use, that sort of thing. The thing with sleep hygiene is that the studies that look at that as an intervention for insomnia don't find that as a standalone thing is that effective. And so people that have chronic insomnia, they try sleep hygiene, that they try to reduce their caffeine, they try to maybe get outside, and they sometimes just don't find that it's helping. And so sleep hygiene can be very helpful in terms of, as a general rule, around things that maybe make it easier or harder to sleep. If you're having caffeine late in the afternoon, it might still be in your system and it might be a little bit harder to fall asleep. But if you have chronic insomnia, you have a lot of anxiety about going to bed, you have a lot of anxiety about not sleeping, you go to bed and you toss and turn, you find that your mind's very active. Some of these tips around maybe being off your phone for an hour might not in itself be able to solve that for you. And so that's where other treatments that might include these tips as part of it, but have much more. Well, the main one is called CBTI that I think we'll sort of come back to throughout the presentation, but that's a behavioral cognitive approach that looks at your thoughts, your anxieties, and your sort of the connections that your brain has with the bed. And so we'll probably get more to that throughout today. But
there's a good fact sheet too. We've got on the Sleep Health Nation website a cognitive behavioural therapy for insomnia, CBTI fact sheet. So you can have a look at that too. But we'll get back to that, I'm sure.
Can I just make one comment? And I'm just about sleep hygiene. Sleep is probably the one thing that the harder you try, the less likely you are going to sleep. So it's really important that while you do these tips and make sure that you are sticking as much as possible to them, that if you find that you're trying harder and harder and harder and you're starting to get really anxious about not sleeping, it becomes an incredibly vicious circle. So it's actually got a term, sleep anxiety. So anxiety about not sleeping, which means you're going to sleep worse. And so, like I said, it becomes an incredibly vicious circle. So if you're getting into that spiral, really important that you don't just keep trying harder and harder with the sleep hygiene, that you actually go and talk to somebody about it before it becomes a real problem for you.
Yeah, I always tell people that, there's many things in life that we can choose to do. We can choose to stand up, we can move our hands, we can eat, we can lie down. But one thing that we can't choose is to sleep. And it's frustrating. I don't know why we can't. It'd be great if we could just, okay, I'm tired, I'm going to sleep, and it happens. But it's not like that. It's very sort of internal biological things that happen in your body that transition you from wakefulness to sleep. And as Linda just said, if you're feeling frustrated, if you're feeling anxious, if you're feeling that pressure to fall asleep, it tends to backfire, if anything, and it makes you more aroused and more awake.
Yeah. If we, I mean, within that sleep hygiene, like Henrique, I'd love to have anything you wanted to add around, like specifically around napping, around alcohol use,
Yep.
technology use. Like, there's so many things, but just as brief as you can, I guess. I'd love to hear your thoughts on those specific things within the sleep hygiene lists.
Sure. So with napping itself isn't bad, but I think of napping similar to, also, for example, one of the things that help us sleep, that biological process, is called sleep drive. It's kind of like hunger. So the longer that you go without eating, you get hungrier. But if you have a snack before dinner, when you get to dinner, you'll be a little bit less hungry. And it's a little bit with sleep. And so if you nap in the afternoon, it might be that you're a little bit less hungry for sleep at night. If you don't have sleep problems, then some people nap and they're fine, and ideally you want to keep it relatively short. But if you are finding that you're really not falling asleep at night, you might have that need to nap because you're so exhausted, but that will just make the next night harder to fall asleep. And so if we can push through, that's very helpful. And just quickly with alcohol, alcohol maybe helps you fall asleep, it sort of sedates you, but we just know that your actual sleep quality is much worse. And so it's one of the things that it maybe helps you, the part of the night that you notice helps, which is when you're, okay, I'm awake and now I'm sleepy and I fall asleep. But the actual throughout the sleep that you're not noticing, the quality is worse, and you might not realize it.
Sounds very much like kind of maintenance sort of thing. We've got, people watch what they eat all the time. People watch how much exercise they're doing as well. Is it kind of similar to that in the respect of sleep hygiene being maintaining your kind of quality of sleep? Is that kind of the right vibe?
Yeah, it can help with prevention. And so if we have good sort of sleep habits, it might prevent insomnia coming. And it is a helpful thing. And cognitive behavior therapy for insomnia, sleep hygiene is one of the things that we teach. And so it is a helpful thing. It's just, I think there's too much emphasis placed on that. And a lot of people try that and they think that that's the intervention and the treatment for insomnia. And unfortunately, for chronic insomnia, it's just not enough.
Yeah, brilliant. I did have one question for you, Enrique, around social media hacks, because I do see a lot coming through my feeds all the time. I don't know, what have you seen, and kind of do you have any that you want to address or want to, bust, if that makes sense?
Yeah, I see some, and I'm not on social media too much, but I hear a lot of questions from people that have seen things on social media, so I hear it sort of secondhand. But whenever I do presentations or something, I get a lot of questions about specific, does this help? Does that help? What should I drink before bed? A lot of these things, I think we're maybe interested in hacks. We're interested in finding this one thing that's going to help. But for the most part, a lot of these things, sometimes it's a bit of placebo. It can be a little bit of a routine. And so maybe, okay, I have a tea before going to bed. That could help. And a little bit of that is just, it's calming. It's the body, if we do it regularly, the body realizes, okay, I've got a bit of a connection, a bit of a routine, and I'm about to go to sleep. And so it starts to become ready to sleep. But they're not in itself as effective as some of the other treatments for insomnia, which might be looking at our anxieties around insomnia. It might be not being in bed and doing other things in bed, like scrolling, reading the news, doing work emails. These things that if we can avoid doing things in bed that aren't going to sleep, that is much more effective than a lot of these other hacks. You mentioned mouth tape. I'm not too familiar with that. I think my understanding is that it's both not very effective and there are risks associated with that. Maybe Linda might know more. But I think the mouth tape is much more controversial.
I had my friends, a couple, bought mouth tape because one of them was snoring too much. I'm guessing that's probably not the best. I don't know, Linda, what do you think about that?
So the aim of mouth tape is obviously so you keep your mouth closed when you sleep at night, and it forces you to breathe through your nose. Now, most of us breathe through our noses if we can. So uh, the default breathing at night is through your nose if you can get enough air through your nose. So the fact you open your mouth is because the airflow isn't enough. So keeping your mouth closed, while it can reduce the snoring, may actually make your breathing worse. So I think it's a hack that while some people say that they find it helpful, I usually say to people, at least try it when you're awake, lying down to see if you can actually breathe before you try and sleep with mouth tape that's forcing you to breathe through a partially obstructed upper airway. So my feeling is don't use it. Try and deal with the nasal problems or upper airway problems that you've got, or go and speak to a health professional about your snoring to check whether you may have sleep apnea or a more serious condition rather than forcing yourself to breathe through a partially obstructed upper airway. So
Yeah, no.
that's a big no. Don't, just in case you didn't get it, no.
Yeah. Note to self. I will definitely let them know. Um, yeah.
I'll just,
What?
Now,
sorry.
I'll just go through couple of the other hacks,
Yeah.
the social media stuff. There's a sour cherry drink. There's a few. So my patients come in with the written information on this stuff and say, "What do you think?"
Mm.
One thing to realize with a lot of these things is the placebo effect on sleep is actually quite large. So the fact you're doing something to improve your sleep may improve your sleep. Some of these theoretically may improve your sleep. So I think it's sour cherry drink that somebody suggests theoretically would improve your melatonin and tryptophan, which may improve your sleep. And like I said, the placebo effect is quite significant. It's not going to hurt you. So definitely, if you want to give it a try, give it a try. And if you feel better, fantastic. But if you don't feel better, don't think you've failed, go and speak to somebody about it because, like I said, the placebo effect in sleep, the fact you're doing something is going to make you feel better and may improve your sleep. So that's fantastic.
It's yeah, I one of my colleagues was letting me know about the Sleepy Girl mocktail, which is kind of I don't know,
That's
cherry
the one I
juice,
was
maybe
talking
something
about.
like
That's a
this.
sour
Yeah.
cherry tart thing it's a combination of a few things in a drink. And like I said, if it makes you feel better and it helps you sleep, there's nothing in it that's going to make you sleep
Mm,
worse. So I
yeah.
think that's one thing to realize on a lot of these things.
The algorithm is definitely not feeding me that one. I was going to say, I think we're just running out of time, so maybe moving on
Oh,
to kind of one of our other myths.
Can I just add,
All
I'll
right.
just add one thing before we do that,
Yeah.
Aaron. It's around comments around something like Sleepy Girl mocktail. Yes, harmless potentially for most people. It's a real warning to not get too dependent on it. Like there's teenagers not being able to go to school camp, for instance, without their blender and their cherry juice and their magnesium. Like it becomes a bit of a thing that a crutch.
Mm.
So placebo or not can become a really unhelpful thing, before bed, depending on something that's not needed. Um, and the other thing around, just I suppose a summary around sleep hygiene is sometimes be really aware that if you're as a clinician giving someone a sleep hygiene list, but haven't really necessarily addressed as a sleep disorder, it can be like, or a mental health condition or another health condition that's actually underpinning the sleep problem. It can be the equivalent of giving someone a list of the healthy food pyramid or the healthy dietary guidelines to someone who's got a really significant eating disorder. that you would all know, think, oh, that's not going to be very helpful. It won't be enough, and it won't be addressing the underlying causes.
Mm.
But that's all I wanted to add before. But yeah, Aaron, let's get on to the next myth. It'd be great.
Yeah, I was going to say, Linda actually mentioned something really important there. I think that if you do see a lot of, anything that you do see online around sleep, take it to your doctor. Take it to, speak to your, if you've got a good relationship with them, more than happy to discuss it with you. I think that's kind of the best way to, approach a lot of this stuff as well. Yeah, moving on to one of our other myths. Linda, I guess one of the myths that has come up is that only overweight older men snore or have sleep apnea. Is that true?
No, no, not at all. So anybody from childhood to the elderly, both genders, kids, anybody can snore. So number one, and probably nowadays it's about 50% of the adult population in Australia habitually snore, so have a significant problem with snoring, and that's both genders. Now, the typical sleep apnea patient that we think about is a middle-aged obese male, and that's not right. So realistically, anybody can snore, anybody can have sleep apnea. It is quite prevalent in middle-aged men, obese men, but it can be prevalent in women, children, and definitely in women as we get older, as we go through menopause. The risk of sleep apnea increases, and as we get older, anybody's risk of sleep apnea increases as well. I'd probably say that in my practice, and I see a lot of quite complicated sleep patients, I'd say about 70% of my patients who have sleep apnea are obese, but that means 30% aren't. And quite a lot of those are slim, gorgeous people who don't have a problem. When you look at them, you think you're not the classical sleep apnea patient, but it's anatomy, it's genetics, it's a combination of multiple things, not just your weight. So then it means that losing weight may not be a good treatment option if you're not carrying weight.
Yeah, fantastic. Great answer. Thanks, Linda. Enrico, I want to ask about sleep hygiene. We've sort of got these myths around sleep disorders. So if sleep hygiene doesn't work for someone, they might think, well, the only option then for my insomnia treatment is, sleeping pills.
Mm.
Is that true?
No. So the vast majority of people that do go and have sleeping issues and insomnia do get eventually prescribed sleeping pills, but it's not the recommended first line treatment, and it's not the only way. It's not either sleep hygiene or sleeping tablet. There is that middle ground of more thorough sleep treatments such as CBTI, but that don't go all the way to the sleeping pills. So the sleeping medications, for example, the most common one is benzodiazepines, which is what our service helps people with. They have a high risk of dependence if you use that long term, which is where our service comes in. They can be quite effective in the short term, and so if someone has a very short term specific reason why they can't sleep, often jet lag, then benzos are actually quite helpful in helping people sleep, but it really should be prescribed sort of lowest dose, lowest amount of time, but very regularly we're seeing people that have been on it for years or decades. And the issues there is, one, the medication there's a tolerance that builds up in the body, so often people need more. They can become dependent on them, both physically, so that there can be a sort of withdrawal when they try and reduce it, or even psychologically, like you were mentioning, Moira, about like the crutch. And so that's a big thing of, oh, I need this medication. And there's that psychological component of people now only get used to sleeping with the medication, or they've tried reducing the medication and they had rebound insomnia, which can actually just be a withdrawal symptom, but they can interpret it as, oh, this is the evidence that actually I can't sleep without it. So they come back on it, and people can really find it hard to get off the medications. To make things worse, the medication and long-term evidence suggests actually does make your sleep quality worse. And so even though subjectively people do tend to feel that it's better when they interview people, they report sleeping better, but when they actually measure people's sleep, even in the short term, it's not as good as people usually feel that it has been in terms of the improvements. But in the long term, it does tend to start to impact the architecture of people's sleep.
That's cruel, isn't it? That's cruel, isn't it? When you're sort of taking something to help you to sleep and then it, inadvertently makes it worse.
The other thing to be a bit wary about with particularly benzodiazepines is if you've got a breathing disorder in sleep, such as sleep apnea, you may actually make your sleep apnea worse if you're taking a
Mm.
benzodiazepine. So it's really important if you feel worse when you wake up after you've taken a sleeping tablet, again, tell your doctor that because it may actually mean that you're making your sleep disorder, the initial thing that caused the sleep problem, you're actually making that worse.
Yeah, so if you go to your doctor, I'd say, and if you got insomnia, like I know I've said this a few times already, but CBTI, so this is cognitive behavior therapy for insomnia, it's something that um, it's generally short term, so usually it's around 6 to 8 sessions, and it has long-term benefits, and you're not then relying on this external medication that you got to keep paying for forever, and that has these side effects. CBTI is just really helping you with your thought patterns, with your behaviors, with the connections that your brain has between being in bed and being asleep, and it's much more effective in the long term. You can look up. I think the Australian Sleep Association has a directory of people trained in CBTI. If you search up Sleep Central CBTI directory, you should come up with different people that have had training in this. And so very few people actually seek this out, but it's very effective and the first line recommendation.
Absolutely. And Sleep Health and Nation fact sheets too on insomnia has lists of other online, um, you know, courses you can do for free with the CBTI. Thank you so much. In the interest of time, I'm just going to go on to the final myth we had. I'm going to ask you, Aaron, that all people with narcolepsy fall asleep spontaneously like they do in the movies, like just fainting in any place, in any situation. And people with narcolepsy and other types of being excessively sleepy can't get a driver's license. Tell us about those, Aaron, those myths.
Yeah, definitely. I guess not accurate. How I guess narcolepsy and how it presents varies a lot from person to person. Um, Often, kind of the sleepiness is a constant background pressure. It's a constant thing you feel throughout the entire day. Um, and it's not kind of this dramatic instant, collapse or falling asleep. Don't get me wrong, for some people that does happen. I've had instances where I've been kind of walking with my partner and I've fallen asleep and he's kind of had to direct me. Um, or, yesterday while I've been working late into kind of 3 p.m., 4 p.m., and then I've fallen asleep at my desk. So for some people, yes, you can fall asleep like that. But yeah, it's not often not as dramatic. Um, there is this other symptom that people with narcolepsy type 1 do experience called cataplexy. And it's kind of muscle paralysis or kind of, losing muscle tone or sometimes collapsing when they experience strong positive emotion. But again, that's very different from the falling asleep, the tiredness as well.
Yeah,
So
yeah,
it can be difficult to kind of, distinguish between these symptoms as well.
not as stark sometimes.
Yeah,
And do
exactly.
you,
And
do you have a
we
driver's license?
I do have a driver's license. And I guess that's also the important thing. People with narcolepsy and other hypersomnia disorders can get driver's licenses. Driver's licenses in Australia, it's assessed against OSRO's assessing fitness to drive standards. So there are kind of standards out there that kind of govern this. What matters, I guess, is that the symptoms that you experience and whether or not they're adequately controlled. And I think that it's really important to have the conversation with your treating sleep specialist, even your doctor, if you're not up to that stage yet in the diagnosis, right? If you are falling asleep or feeling tired while you're driving, have that conversation with them because it doesn't automatically disqualify you from driving. It's just all about making sure that you're safe, other people on the road are safe, and your passengers are safe as well. So yeah.
Yeah. Great. Well, we've got 6 minutes left, and we've talked so much about the sort of the myths we had there and thank you, the wonderful sort of discussion and debunking of the myths and really in depth and expert. We have got a bit of time for we've got 5 minutes left. So we've got one question already from Callie. I'll read it out to you, and I don't know, between Enrique and Linda, you can have your comments. I wake up multiple times, sort of 6+ during the night. I can get to sleep, but I struggle to stay asleep. I wake up and turn over, then fall back asleep. And I've heard that this is normal. What do you think? Linda first.
Okay. So if we think about sleep, and we go through different stages of sleep, and we go through different cycles of sleep. So in a normal sleep cycle, which is about an hour and a half, we go through multiple different sleep stages, and often we'll go through light non-dream, deeper non-dream, and then dream sleep. And each cycle is about an hour and a half. Now, when we wake, and so people do go through light sleep multiple times during the night. And like I said, these cycles are about an hour and a half each. So it's not uncommon after a sleep cycle when you're going through a light stage to get to full wakefulness. And then go back to sleep. So it depends if you can get back to sleep, and it depends overall on the quality of sleep overall. So do you wake refreshed in the morning? So just realizing that it can be normal to wake up multiple times a night as you go through that light sleep, but as long as you go back to sleep and as long as overall the quality of your sleep is good and you feel good during the day, I wouldn't be too worried about it. It's when it becomes a problem, or you're tired when you wake up, tired during the day, that is a problem. But it does depend on the clinical circumstance with the whole process.
Henrique, would you add anything to that?
I agree with all of that. Maybe I'll just add, yeah, when it starts, another time when it starts to become an issue is when people start to wake up and then they get anxious about that. And then that can turn what could be maybe 10 seconds, 20 seconds awake into minutes or an hour or more. So I think what Linda said is true. And that can help people to, okay, I've woken up, but not get stressed about it. It is a normal and common thing. If you then awake for a while, then that's when you might want to reach out to somebody for help.
Yeah, can we have a quick comment on trackers, wearables, and those sleep scores and percentages of sleep stages? And I think it'd be just in a couple of sentences each what your views are on that, because it's Amita's asked about 50, 30% REM and all that. We always hear that people have a really set idea now from the internet of how many percentages they're meant to have. Enrique first.
My understanding is that these watches are not as effective at actually being accurate with the stages. I think they're better at knowing if you're asleep versus awake, but not as accurate in knowing whether you're in deep sleep, shallow sleep, REM. So one, I maybe wouldn't get too worried about it. And the other part is that there's not much we can do. And so a lot of people do ask, hey, how do I get more of this? How do I get more of that? The body does naturally try to even it out. So if it's not getting too much REM, it will, to a degree, try and get more REM in a future sleep cycle. So we don't have to worry too much about it. There are things that we know might impact. So like drinking alcohol, medications. And so these things we can choose to sort of avoid. But I think these days there's maybe too much information that just contributes to anxiety and contributes to overfixation on our sleep and our quality, and that in itself doesn't help.
Linda, final comments on trackers and percentages of sleep stages?
I think they're good to give you a bit of an idea of what's happening with your sleep. But like Enrique said, they're quite good at actually telling you if you're awake or asleep. They're not great at differentiating between the different sleep stages. So while it might give you a little bit of information, don't get too hung up on it. If it's giving you, if you feel good, don't worry what your tracker's saying. If you're feeling bad and your tracker says your sleep quality is good, again, it's really how you feel rather than what the tracker's actually saying. So really go on how your body feels, how you're functioning during the day, all of those things rather than what your watch is telling you or your tracker's telling you.
Yeah, perfect. I promise Erin will get back to we won't be able to talk about sleep talking. There was a really good question curious about sleep talking, but I'll personally make sure I write back to Erin, or we'll connect somehow to talk about that, or Linda might be able to, just dobbing you in, but I'm happy to.
No, happy to do it.
So I think in the interest of time and the dying minute, I just wanted to thank very sincerely Linda and Enrique and Aaron and I on behalf of Sleep Health Foundation for your expertise, for your generosity, for this really great discussion. I think a lot of people have got a lot out of, so helping us to debunk and bust open those various myths. You'll see on your screen, we'd really love to have your post-webinar survey. Love to give us feedback on the webinars and any other ideas you might have for forthcoming webinars. There's fact sheets at the Sleep Health Foundation A to Z. There's 100 or so fact sheets on a range of topics, and I really, really encourage you to look at those. Reconnections, we're Enrique and his team do wonderful work helping people with their sleep, coming off specifically their sleeping long-term sort of dependence on sleeping pills, and great education and support around that in a non-judgmental way. So hats off to you and your team. And our Aussie Sleep Snapshot survey, that's an annual survey that we ask the households of Australians various questions every year. That was released this week, and I'd love you to have a look at that, the main findings. So shall we just leave it at that and say goodbye? And thanks very much, everyone.
Thank you.
Thanks,
Thanks.
guys.